88-year-old male after fall and long lie. This is the CT head of this patient. The first finding is extensive left-sided low attenuation in the middle cerebral artery territory with sulcal effacement and minor central deviation to the right. So here, extensive left-sided low attenuation in the middle cerebral artery territory. So this is the middle cerebral artery territory. The middle cerebral artery gives cortical branches to supply the lateral part of the cerebral hemisphere. So the medial part is supplied by the anterior cerebral artery. However, the lateral part is supplied by the cortical branches of the middle cerebral artery. The lateral part, okay? Also, the middle cerebral artery gives deep penetrating branches called the lateral lenticulostriate artery to supply a part of the basal ganglia called lentiform nuclei. Okay, so here the low attenuation is seen along the lateral part of the cerebral hemisphere. However, the medial part is spared, as you can see here. The lateral part, the attenuation. This is the caudate, and this is the lentiform nuclei. The lentiform nuclei is spared here too. Okay, so the basal ganglia is not involved here, and the low attenuation is seen along the middle cerebral artery territory. This low attenuation is associated with sulcal effacement. Can you see the sulci here? Sulci here. All of these sulci are effaced by mass effect from this low attenuation. Okay, can you see the sulci here? All of these sulci are effaced. The sulci here are effaced here. Also, this low attenuation causes a minor midline shift to the right, minor central deviation to the right. Only a minor central deviation to the right. Next sign, as you can see here, this is the bifurcation of the internal carotid artery into anterior cerebral artery and middle cerebral artery. Okay, the left middle cerebral artery is hyperdense here. This is called hyperdense vessel sign, which is a strong sign of cerebral infarct. As you can see here, there is also subgaleal hematoma. Subgaleal hematoma. Hematoma in the scalp. This subgaleal hematoma is overlying the right orbital rim. So if you go downwards, the subgaleal hematoma is overlying the orbital rim, the right orbital rim. So the interpretation here, I have hyperdense vessel sign, the hyperdense vessel sign, along with the hypoattenuation in its territory. Hyperdense left middle cerebral artery, along with hypoattenuation in the left middle cerebral artery territory. Can you see this hyperdensity in the cortical branches of the left middle cerebral artery? Okay. So the diagnosis here is extensive recent middle cerebral artery infarct. Extensive recent middle cerebral artery infarct along with the subgaleal hematoma. The subgaleal hematoma here is usually from the traumatic injury. This patient history includes falling, and long lie. So this subgaleal hematoma is most likely to be from a traumatic injury during the falling. The management here is urgent referral to stroke team. Whenever you see a patient with cerebral infarct, this patient needs urgent referral to the stroke team in the hospital. So that's it.